Hi, my name's Ian Battersby. I'm head of the internal medicine department at Davies Veterinary Specialists, and welcome to another of our Davies Out of Hours podcasts. As you know, we do these Out of Hours podcasts quite regularly, typically in the pub or a tea room, but at the moment, because it's the COVID lockdown, we're doing them remotely, so our format looks a little bit different. Just as a quick reminder, we've got a variety of different CPDs that are available, some live that you can listen to and ask questions on social media, some recorded. So please contact our marketing department if you're interested in any of those. We'll put the email address in the comments section. These podcasts are available on YouTube, and we've covered a variety of different topics, including electroablation of cardiac arrhythmias, physiotherapy, pain management, and things like that. We can also provide them in audio-only format, so you can listen to them on your phone when you're on a walk and things like that. And if you want them in that format, please give our marketing department an email as well, and we can send them to you. So we've covered leishmania. We've covered leptospirosis in a different podcast, and today we're going to talk about Babesia. And today I'm again joined by our internal medicine, Davies internal medicine infectious disease expert, Patricia.
Hello.
Hello.
I like my title.
Yeah, good. So how's lockdown since I last saw you 24 hours ago? What have you been doing?
Well, much the same. I'm looking forward to going back to work, if I'm honest with you.
Yeah.
This computer working is giving me a bit of backache.
Oh, okay. Well, you should do some Pilates or something.
I know. I should.
Loads of, yeah.
I should.
I'm for a little walk. I'm now benefiting from that. I didn't panic buy toilet rolls or rice or pasta, but when the lockdown happened, I panic buyed on Amazon and bought paints and colouring books and water pistols and even a paddling pool. And the benefits of that now are coming to, because we've had the kids in the house now for about 2.5 weeks, and we kept them in a box. So that's what's coming out today, because it's been
nice weather for paddling pool.
Absolutely, but it's been character building. Keeping the kids from arguing. Anyway, we're diverging. We could go on like that for a while. It's like, because we haven't seen each other, we're catching up on stuff. So we need to talk about Babesia today.
Oh, yes.
And I guess following a similar format to what we've done in other infectious disease podcasts, we'll have a little bit of a structure and we'll move around, but we'll cover the basics first. And that is, first of all, understanding the organism and then how it's transmitted. With Babesia, we know that there's, there's a number of different species of Babesia. So maybe if you could start outlining that and the geographical distribution.
Yeah, so in Europe, which is where most of the dogs that we deal with would travel to, it's mainly Babesia canis that we see. So that's the most common etiological agent of babesiosis. But we do see other Babesia species in Europe. So we see Babesia gibsoni in some parts of southern Europe, and we see Babesia vogeli as well. But far less common than Babesia canis. In the US, for example, Babesia gibsoni is very, very common. I'd like to say more than Babesia canis. An interesting thing is that Babesia gibsoni can be transmitted by ticks, Babesia gibsoni can be transmitted like ticks, like Babesia canis, but it can also be transmitted by bites.
As in animal to animal bites.
Yes, and in the US, that's an important mode of transmission in dog fights, for example. So it is seen in dog fighting breeds, outbreaks of Babesia due to bites, usually where there's a big transfer of blood, so quite dramatic bites. I'm sorry to say. But in Europe, the main mode of transmission is by ticks. So and Dermacenta reticulatus is the main tick that will transmit Babesia canis.
Okay. And when we think about those species, I guess that, from a UK perspective, because this is a UK-based podcast, we're largely thinking. Well, we'll talk about UK cases in a moment, but we're largely considering these this being picked up in dogs that have travelled abroad. So with each individual species, like for example with South Africa, if a dog had come in from South Africa versus a dog from Europe, does the species type of Babesia affect the potential severity of the disease?
Yes, it does. So some species of Babesia cause more severe disease than others. So for example, Babesia canis causes a kind of moderate to severe disease. So does Babesia gibsoni, Babesia vogelii, maybe less severe, Babesia rossi, extremely severe. So the clinical presentation can be different depending on the species. Yes.
Yeah, and when we say, I mean, with rossi, I mean, I've never seen a case of rossi, but that we're talking quite is it acute, peracute, or?
Yes, they can have peracute disease, and death is not uncommon with Babesia rossi.
Yeah.
Thankfully, we don't see those cases because we don't see Babesia rossi in Europe.
Yeah, so talking. I mean, we talked about imported, we should consider this in dogs that are rescued or dogs that have been on holiday. But what about reports of non-travel dogs in the UK?
Yes, so very, very interesting, because we obviously there have been cases of autochthonous Babesia before, just kind of random solitary cases here and there. So we were aware, just like with Leishmania, of the odd case of non-travel dogs that got Babesia. But we had a cluster of cases in Essex, which I'm sure you're all aware of, 2015, 2016, and 2017. We saw 7 cases. The first 4 cases in Harlow. Then the following year, another 2 cases in Romford, and then in 2017, 1 in Ware. And they were all cases of Babesia canis. And the vets that were involved with those cases were very quick at picking it up and reporting it. And thankfully for all of us, the disease appears to be quite well controlled, and we're not aware of any cases having been reported since then. But they did tick collection in the areas where these cases were reported, and they saw a population of Dermacentor reticulatus which were infected with Babesia.
Okay.
So there was a problem in those areas.
So I guess that leads us to an evolving situation in the UK, that it's a dilemma that people in other countries where they have Babesia endemic. Oops, sorry, that was my mum phoning.
Oh, I missed your ringtone.
Oopsie, I'll just mute that. How embarrassing. Switch your phone off before you start. So yeah, and I suppose those non-travel cases and the evidence of Babesia in those ticks kind of starts moving the UK to that dilemma about, because I suppose what we haven't done is talk about, the pathology, what happens with these cases. It's a hemolytic process, and in fact, quite a large proportion of them are Coombs positive, if I remember correctly, as well. So you can't even use Coombs as a potential differentiator. Yeah. So the question is, if you've, IMHA, we seem to see waves of it in our clinic. Is there now sufficient evidence that we should start testing for Babesia if we've got a case that has signs consistent with it, or clinical changes, consistent with IMHA?
It's a very good question, and certainly when this outbreak was going on, I became very conscious of it. And every dog with IMHA, I would test for Babesia, but I became a little bit more less compliant since then. And I have to say, I'm not testing every single case of IMHA. But we will miss them. If we're not testing, we will miss them. The tick is here in the UK, so we know that we've got population of Dermacentor reticulatus in certain areas. For a number of years, it's been in Wales and some areas of kind of northern England, but obviously there is a population of it in Essex as well. And it's only a matter of time for that population potentially to become infected with Babesia. So it's a good example of a situation where we've got a disease that's not endemic to the UK, but where we have the vector. And it's not very difficult for the infectious disease to enter this country and populate the current the population of vectors that we've got.
Yeah. I suppose one thing we haven't touched on as well is we focus very much on Babesia in dogs? Are there, I mean, we talked about in other infectious diseases, other species that are affected. A Babesia infection is going to be recognised in any of the species we see, or just dogs?
Yeah, so it can affect other species, and in fact, there are species that, for example, affect deer. So deer get affected by certain species of Babesia that don't seem to affect dogs, for example. But again, they can be a reservoir for infection, and in cats, disease is quite rare. So they're not. It's not very common, and Babesia doesn't seem to affect people, so it's not a zoonotic disease.
Yeah,
but it can affect other species for sure.
So we've already hinted about the clinical presentation, but I suppose it's now appropriate to kind of delve into that in a little bit more detail. So, and again, we've already talked about some of the different species will have different speed of onset and severity of diseases. So if we maybe just review, the progression of infection and maybe start maybe trying to hint, trying to give an overview of different species and how they might vary presentation and things like that, if it doesn't get too complicated.
So the they probably all have similar presentations, but just bearing in mind that the severity of the disease might be different with different species. But I think rather than talking about each individual species, I think it's fair to say that Babesia can present in three forms. So you can have a kind of acute or peracute presentation. So animals that present with kind of an acute hemolytic crisis. So just as you would expect with the case of IMHA, hemoglobinuria, jaundice, acute anemia, collapse, and so on. Some of those cases can be extremely severe. They can develop acute kidney injury. They can develop severe pancreatitis, collapse, and death, So those are the kind of peracute to acute presentations. You do get a subset of animals with Babesia that are asymptomatic, and that's important to remember. So you can have dogs that carry Babesia for a number of months or potentially years, but probably more months, and don't have any clinical signs. And then you have the more kind of chronic presentations of Babesia that can present with thrombocytopenia, anemia that may be non-regenerative, immune-mediated diseases like, for example, polyarthritis, fever. So I have seen in the clinic dogs that have presented, mainly rescue dogs from abroad, that have had thrombocytopenia, mild non-regenerative anemias that have been diagnosed with Babesia. So you don't always think of the very kind of acute or peracute presentation. You do get the chronic ones that may look like an ITP or just a sick dog. And so, you should keep Babesia in mind even with those kind of chronic, less typical cases.
And I suppose that's where clinical history, is important, finding out where the patients come from. But also, I mean, we talked about it in Leishmania, the incidence of cross infection as well. Some of those patients may not just be, they may have, thrombocytopenia, and it's not just, don't test just for Babesia. It's other diseases as well, because that influences your treatment.
For sure, and co-infection with, for example, Ehrlichia is quite common. It's a different vector, the vector for Babesia canis and the vector for Ehrlichia. But the co-infection with Ehrlichia and Leishmania is quite common. So if you've got one, just think about the others as well. Yeah.
So if we get if again we've kind of taken a history, we've looked at the initial clinical exam, and potentially we found it's anemic, thrombocytopenic, and we're concerned about Babesia. What are our testing options?
So again, I'm saying the same for every case, but it's true that for infectious diseases, you've got identification of the organism and then evidence of exposure. So identification of the organism in the case of Babesia is easier potentially than in other infectious diseases because it's in the blood and it's within red blood cells. So quite often you will see it on a blood smear, particularly if you do a blood smear from capillary blood or just blood under the buffy coat. You're more likely to see it in those smears, and then you will see the organism within red blood cells. And remember, Babesia canis looks different. So it's one of the large Babesia, so it looks different from Babesia gibsoni. Babesia gibsoni is small and round, and to the non-expert eye, it looks like nothing. Babesia canis is piriform and looks a little bit more dramatic, should I say, or more like something that shouldn't be there.
Less like a staining artifact.
Exactly.
And I have to admit, in the acute cases I've seen, it's typically at the weekend or something. Make a smear, have a look, and that's where your suspicion starts. But certainly,
the fact that you don't see it does not mean that it's not there. So PCR will increase the sensitivity of that.
Particularly in the more chronic cases, I guess.
Yes. Yeah. So PCR is useful to try and rule it out. You can't completely rule it out, because we should always take the approach that a negative PCR result does not mean that the infection is not there. It just means that the organism has not been detected in the sample that you have detected.
Okay, and I suppose that raises the question then, if we've got IMH, and I'm just thinking off the top of my head now, if we how do they deal with this abroad? If they've got those cases where it's got IMHA, they're in a Babesia endemic situation, and they've got negative testing.
Yeah. So, I mean, in places where they see a lot of Babesia, they become very good at diagnosing it. So people will diagnose it in practice on blood smears and things. So it's not a difficult disease to diagnose. So quite often in those places where there is a strong index of suspicion, they will treat them. But most of the times you can see it when it's there if you take the right samples.
Yeah. And I suppose there's nothing wrong with. Oh, sorry. There's nothing wrong with repeating sampling, is there?
No, for sure. And I mean, if you're in one of those areas where they see a lot of Babesia, IMHA is caused by Babesia unless proven otherwise.
Yeah, I suppose so.
So that's the first thing that they think of in areas where it's very prevalent, which is something that we don't think of very often.
No, it'd be a complete mind switch for us, because of we tend to see IMHA. So if we're going to treat these patients, what options have we got?
So again, this is where speciation is important, because the different species get treated differently. So the large Babesia, like for example Babesia canis, gets treated with and responds very well to imidocarb.
Okay.
So 2 injections of imidocarb, usually enough to 2 weeks apart to get rid of the organism. Some of these dogs can become persistently infected, so it might take the clinical signs, control the clinical signs, but just bear in mind, like we said with leishmania, that the animal may become kind of chronically infected and may have relapses at some stage.
So in those cases, the treatment stabilizes the patient, controls it, but we have to bear in mind that once infected, they could potentially, if they have another illness, it could cause a relapse, or if it develops if it develops skin issues, and you're going to give it some steroids, for example.
Yeah, and particularly with the chronic cases, acute cases and peracute cases, if they survive the initial stages, you might have a better chance of controlling the parasite better, or even a cure. But chronic cases are more difficult to treat. And
then, so I guess if sorry, I'm trying to remember if we've covered this. Imidocarb, and then other options for other species.
Yeah, so imidocarb for the large Babesia. The small Babesia are more difficult to treat. So Babesia gibsoni, it's more difficult to treat, and we normally have to use a combination of drugs. So atobacone and azithromycin as a combination is normally what's recommended for Babesia gibsoni. If you've got other species of Babesia, it's worth just asking for advice on treatment, because the small Babesia, as I say, are very difficult, quite difficult to treat. When you do a PCR test, they can speciate, and that's the good thing about PCR in the case of Babesia, that they can tell you what species of Babesia you're dealing with. And remember that in most cases, it will be Babesia canis in this part of the world.
So I guess coming on to another question then, and we always like to do this, we always like to create the Friday night, everybody's gone home and the lab's closed scenario, because that's all what we fear. So I'll do it now. It's Friday night, you've got an owner the owner that's just driven back from Spain, and the dog looks quite pale. You've done a PCV, it's quite low. You do a smear and you think you can see Babesia organisms. You know, you can't obviously speciate.
No.
So, what is imidacloprid your kind of first go-to drug whilst you try and speciate?
Yes, so for sure. I mean, they look different under the microscope. So if you're seeing piriform shaped organisms, that's likely to be Babesia canis or one of the other large Babesia. So yes, imidocarb would be your
first line.
And remember that they need supportive treatment, just like any other dog with IMHA. So blood transfusions, fluid therapy.
Yeah. And what about thrombosis risk? Because with IMHAs, we typically put them on clopidogrel and things like that.
Yeah, well, I don't know. I don't know how often they agglutinate and how often they're at risk of thromboembolic disease.
And I suppose the other sorry, that was just something I thought of. You have to consider whether if they're thrombocytopenic, that's something you're never going to go near, isn't it? If they've got concurrent thrombocytopenia, thinking they might have concurrent disease, Ehrlichia or something like that.
Yes, again, very good point. So if they are concurrently thrombocytopenic, hyperglobulinic, although Babesia can cause thrombocytopenia, I just think about the other potential co-infections.
Yeah, absolutely. And what about availability of imidocarb? Because some of the drugs can be...
Yeah, imidocarb is a licensed drug in the UK, and they use it a lot in farm animals, so it's not difficult to get hold of. But I understand that people on a Friday night, small animal vets will probably not have it on the shelf. So you might have to ring around a large animal vet.
Yeah, so certainly I've received referrals where purely because of drug availability, where there's been a strong suspicion. I'll say Saturday night rather than Friday night, just to vary it up a little bit. But I guess those people were, I suppose, it would be, it would be beneficial. I don't know if it's a particularly expensive drug. I can't remember. I know there's big bottles of it, so it may be a drug to, particularly with endemic cases in non-travel dogs beginning to appear. We'll have to see how Brexit affects pet travel, but it's certainly a drug that you ideally have on the shelf as a go-to drug if needed. So
I mean, certainly in 2016, 2017, we were all worried that this was going to become the disease that we were all going to see, but it seems to have calmed down. So I think that it was very well featured in the media. As I said, the vets that were involved with the outbreaks handled it extremely well. That made quick diagnosis and informed everybody. And then owners became aware. Everybody started treating preventative treatment. The parks were closed, and it was a very good example of very effective infection control.
Which is a seamless link onto prevention, which we haven't covered yet.
Indeed. So again, avoid exposure to the tick. It's your best treatment prevention, and you want to use drugs that are repellent, tick repellent drugs, or that kill the tick quite quickly, so within a few hours of attachment. And of course, no drug is 100% effective. So I will say this, and of course I never do it myself, but when you go out for a walk with your dog, particularly if you go in areas where there is cattle or deer, and kind of wooded areas, long grass areas where there may be ticks, and particularly in the kind of warm, high rain seasons, then make sure that you remove ticks from your dog. So that's the best way to prevent most of these tick-borne diseases.
And are there any? I know with some of the infectious diseases, there's some really nice consensus statements or websites. Are there any that you can refer to for Babesia? Is any worth a plug?
So I couldn't find. I could be wrong, but I tried to find a consensus statement. I couldn't find one, so I don't think there is one. But the ESCAP website has very, very useful information. It's a Europe-based website and has got a lot of information in vector-borne diseases in general, and very useful to go there to look for information, papers.
And just for those who are listening who may not know what ESCAP is, do you know what the abbreviation stands for? Is it European Society?
Oh, this is embarrassing. European School. Oh. Shall I
Oh
Google
no,
it?
Google it. We'll do it live. Google. Why
Okay,
I do
okay.
I'll do a filler. In Google.
I look it often enough. I don't know why. I don't know the.
But why Patsy's Googling live, well, not live, kind of while we're recording. We can only do this in one take because of the software we've got at the moment, hence the not pausing the recording. As always, there's just a quick reminder that we've got all these pre-recorded. The next infectious disease podcast we're going to do is on Ehrlichia, and then we're going to do mycobacteria as well. I think that's the other two we've got planned, isn't it, Patricia?
Yes, I believe so.
Yeah.
So I found it is European Scientific Council of Companion Animal Parasites.
Cool. Good. Thank you for finding that. I'm sorry for.
It's a great website. I have to say.
It is.
I'm a
It is a
fan.
great. I know. But well, we hope that you found that useful. We even can spontaneously use Google during recordings, which is isn't technology amazing? So, like I say, there'll be podcasts in the future coming out. If you email our marketing team, we're very happy to make you aware of them when they come out. And thank you once again to Patricia. A really informative, interesting discussion. And look forward to our next one. And everybody who's listening, stay safe.
Thank you, everybody. I'll see you soon.